everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Tiotropium. Its brand name is Spiriva. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Tiotropium induces bronchodilation via inhibition of M3 receptors on airway smooth muscle. It is a long-acting agent with anticholinergic activity and affinity for receptor subtypes M1 through M5. In terms of indications for use, we commonly see tiotropium used in the treatment of COPD or chronic obstructive pulmonary disease, and it can also be used as maintenance therapy in asthma. Before somebody was to use tiotropium, there is a contraindication they must clear, as well as some precautions and warnings they should be made aware of. The contraindication would just be for patients that have a hypersensitivity to ipratropium, tiotropium, or any other component of this product. In terms of precautions, patients should be made aware that immediate hypersensitivity reactions such as rash, urticaria, anaphylaxis, angioedema, and bronchospasm have been reported. There would be an increased risk of hypersensitivity to this medication in patients who have a hypersensitivity to atropine or its derivatives. It should be used cautiously in patients who have a severe hypersensitivity to milk products. It should also be used cautiously in patients who have narrow-angled glaucoma, as their symptoms may worsen. There would be an increased risk of new or worsening urinary retention in patients who use this medication that have prostatic hyperplasia. Patients with bladder neck obstruction would also have this increased risk. There would be an increased risk of experiencing anticholinergic side effects in patients who have moderate to severe renal impairment. This medication should not be used as a rescue therapy in acute bronchospasm. And lastly, paradoxical bronchospasm has been reported with the use of this medication. Now, once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start using tiotropium, they can expect to take their dose using a handyhaler to inhale the contents of capsules. The treatment of COPD, typically patients would inhale the contents of one 18 microgram capsule using their handyhaler once daily. It's important to note that the capsules should never be swallowed. In the maintenance treatment of asthma, patients would have 2 inhales, which would be 1.25 micrograms per inhale once daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using tiotropium or Spiriva, so I'll list some of those here now. Constipation can happen between 1 and 4% of the time. Xerostoma can happen with the spray about 4% of the time as well. The frequency of xerostoma would increase to about 12 or 16% when the powder is used. About 4% of patients may experience a headache. Some patients may experience urinary tract infections. Bronchitis can happen about 3.3% of the time. Cough could develop up to 6% of the time, and pharyngitis about 7% of the time. Upper respiratory tract infections have been reported up to 43% of the time, and some patients may also experience sinusitis. Now, some more rare but serious side effects would be bowel obstruction, immediate hypersensitivity reactions, the development or worsening of angle closure glaucoma, urinary retention, and finally, bronchospasm. That's all we're going to talk about today with tiotropium or Spiriva. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.